right, so this will be Group C's presentation of our chronic disease about a brief overview of rheumatoid arthritis. So, rheumatoid arthritis is a chronic autoimmune inflammatory disease and disorder that causes pain and affects a patient's joints in their day to day life. It's commonly classified and diagnosed when a patient is noticing excessive pain among the joints as well as similar pain on both sides of the body. It affects about 1.3 million people in the US, and it's 2 times more prevalent and likely to develop in women than in men. And so, it's affecting the most commonly used joints, such as the hands, wrist, and knees and ankles. And in more severe cases, and if left untreated, it can also affect additional tissues in the body, like the heart, lungs, and eyes. So, if a patient has RA, what's going on is that their body's antibodies are mistakenly attacking the tissue surrounding the body's joints, ultimately causing damage. At this moment, the underlying trigger for RA is unknown as it is an autoimmune disease, but there may be other factors that play into the progression and prevalence of the disease. So, some of the increased risk factors include being a woman and having a genetic history of rheumatoid arthritis. And if you are smoking, you are also more prone to developing rheumatoid arthritis. So, as it stands at this moment, there is no cure for rheumatoid arthritis, but there are some routes a patient can take to relieve some pain and mobility. So, there's medications and anti inflammatories that the patient will be able to take to relieve some symptoms, as well as therapy to help get some mobility back. Surgery is available. There's some additional options that may be able to alleviate some of the symptoms of rheumatoid arthritis.
So for our case scenario, we have a 79-year-old alert, well-nourished, and well-hydrated woman who visits our rheumatologist for hand and wrist pain. The patient suffers from anemia that is related to vitamin B12 deficiency. She has osteoarthritis, chronic pain syndrome, osteoporosis, and also a history of polymyalgia rheumatica. The patient reports pain involving her wrist and fingers, as well as bilateral knee pain, with recent swelling on the left knee. She also complains of disabling morning stiffness, which lasts until noon, and she also has difficulty making a full feast. The neurologic examination is unremarkable, and the muscle strengths of upper and lower extremities are 4 out of 5 with no myofascial trigger points. The healthcare professionals, the caregivers at the assisted living where she's staying, attempted to manage her symptoms by increasing her regular dose of tramadol from 50 milligram twice a day to 4 times daily. And they also applied lidocaine patches to affected areas, 12 hours a day when needed. The patient did not experience significant improvement in her joint pain or morning stiffness, so they gave her prednisone 5 milligrams every day, and she reports improvement in morning stiffness. The musculoskeletal examination shows bilateral synovitis and tenderness on the fingertips and wrist, and it can be seen on the next slide.
So the diagnostic findings from the patient previously mentioned, you can see on the right hand that she has that bilateral synovitis swelling and Herbert's nodes. The examination of the synovial fluid under polarized light microscopy reveals neither monosodium urate nor calcium pyrophosphate dihydrate crystals. X-rays on both of her hands show diffuse demineralization without evidence of the fractures. In addition to her hands, her knees, there's no acute fracture dislocation detected. The medial and lateral compartments show mild osteoarthritis and moderate joint effusion. The musculoskeletal ultrasonograph of the left knee reveals moderate effusion with the synovial proliferate synovitis on the grayscale and moderate powered Doppler signal. These findings are consistent with the inflammatory arthritis.
For the description of plan, due to previous failing with previous medications, the patient is prescribed 30 milligrams per day of prednisone with 5 milligrams tapered every week to baseline of 5 milligrams per day. Disease-modifying anti-rheumatic drugs are considered as well, and she has started on oral hydroxychloroquine 200 milligrams twice daily. and the patient will be monitored by the facility, and any side effects she might receive, they will be noted and be reported to the rheumatologist for reconsideration. The non-steroidal anti-inflammatory drugs and the biologic therapy for chronic refractory RA will be prescribed as well. The patient would be recommended that we prescribe vitamin B12 to combat the deficiency as well. Patient medication will be monitored and assessed after the first month and again after the 3 months.
Continue to the depression of Lane. The patient should be referred to physical and occupational therapy as well. Help patients to ease the pain in knee and wrist, and also adjust and improve movement. The patient also recommended to explore the holidays. This will be increase the flexibilities, and the patient will be closer to on effect of RA on the body and future issues may incur. Because this genetic disease, so blood test is recommended for early detections, help for prevention and management of this chronic disease according to NHS. And for the plan for behavior theory, we will decide to choose the health belief model because which is used for help patients in behavior change for over three decades according to NCBI. Give the patient perceive of severities that alert them that she might lose the movement abilities and might have the dependent life later happen with her, which that no any elders wanted, and give her perceived benefits for this plan that may make sure that it will help patients to live independence without pain and improve the movement. Call to actions that the most important that the effective communications provide the patients about the current conditions and set up the appointments for rechecks every month with the doctor, working with the therapist every morning for 2 hours and reduce the risk of falling and fall-related injuries with the occupational therapist. And also the best way for this patient is writing the contracts and monitor to help the patient stick with the plan. Set a goal to achieve to change the patient behavior with more exercise and consume more vitamin B12 and fiber, minimize the consumption of sugars and processed red meat, which is high level of inflammation maker, and avoid gluten food.
And that concludes Group C's presentation. Thank you.